Module 2, Understanding the Customer. To serve all the different types of customers, a mobility manager, in concert with partners, must first understand the needs of those customers. This module focuses on how to do that by first identifying who a mobility manager's customers are, and then exploring how to begin to understand their transportation needs. Broadly speaking, there are 4 types of potential customers of mobility managers. First, individual riders and their caregivers. Second, particular groups of individuals, such as the general public, rural residents, people with disabilities, those needing medical trips, etc. Third, agencies and transportation providers that serve groups of individuals. And fourth, your mobility management network. As a new mobility manager, it may be overwhelming to work with many different types of customers at once. Your organization and your partners can help you prioritize your customer focus. Keep in mind that this focus will likely change over time. The most straightforward way to learn about individual riders' needs is through one-on-one or group conversations. Those individual conversations may take place after a referral from an agency or a family member, or when an individual contacts you directly. For individuals with emotional, cognitive, or communication disabilities, it is important to bring family members and/or other caregivers into the conversation to ensure you are able to form a complete picture of needs and resources. If a mobility manager is hired to work directly with individuals, it is likely that those individuals will have complex transportation needs. To guide you in discovering these needs, we have created an individualized transportation needs assessment tool. This document is available in the resources section for this module. You can download the assessment tool to use it as is, or you can adapt it to fit your requirements. Here are the 6 steps of the assessment tool. 1. Explore current transportation options for the individual. 2. Identify where and when the individual needs to travel. 3. Identify considerations that may impact the individual's mobility. 4. Determine if the individual is eligible for ADA complementary paratransit or similar services. 5. Identify applicable community transportation options. 6. Assess the individual's ability to pay for transportation. Let's look at this tool step by step. Step 1. Explore current transportation options with the individual. The needs assessment can begin with a conversation between the mobility manager and the individual and his or her caregiver as appropriate to identify all of the types of transportation options the individual can currently access. A good way to start this conversation is to ask the person how they got to your office that day. Next, the individual can be asked to identify any private transportation options he or she has, such as access to a private vehicle, catching a ride with family members, friends, or neighbors, or more formally arranged shared rides, such as carpools and vanpools. You can also ask how reliable these options are and if they are available regularly or just occasionally. Then ask about public options, such as bus and rail services. The mobility manager can ask about what stops are near home and common destinations, what transportation services they may see running through their neighborhood or past destinations they commonly travel to, and if they know how to ride the available bus or rail services. Note that some individuals may be able to provide answers to these questions with only a little help from you. Others may need another professional, caregiver, or family member to assist them in answering the questions, or even to accompany them into their neighborhood or to common destinations to help them observe available services around them. Step 2. Identify where and when the individual needs to travel. Next, the conversation focuses on what trips the person needs to make and when. All types of trips should be included, such as those to work or to search, interview for work, childcare or other job-related destinations, school or training locations, workforce development agency, other social service agencies, medical services, other destinations, such as those related to legal proceedings, searching for housing, shopping, recreation, leisure, and social activities. As trips for each day of the week are noted, the details associated with the outbound and return journey should be recorded, such as trip destination, who will be traveling, for example, the individual alone, the individual with children, etc., where the trip will start, travel times. Step 3. Identify considerations that may impact the individual's mobility. Note any of the following factors that need to be considered in planning transportation. The individual's basic traveling skills, mobility, functional, sensory, and intellectual or cognitive considerations. Disabilities that are not apparent if the individual chooses to disclose them. Other issues, such as cultural, language, or personal issues. Step 4. Determine their eligibility for paratransit services. Note here whether the individual is eligible for ADA complementary paratransit services and if they need assistance applying for those services. Also note what type of transportation services might be more appropriate, such as shared rides versus one-on-one rides. Is walking or cycling an option? Step 5. Identify applicable community transportation options. The next step is to determine which of the existing community transportation services could potentially fill the individual's needs. Relevant details should be recorded on the worksheet, such as the applicable routes, cost, accessibility, type of service, whether it's fixed route, regularly scheduled service, or demand response service. Any requirement for advance reservations. In completing this worksheet, be sure to refer to the inventory of transportation services you will develop in Module 3. Step 6. Assess the individual's ability to pay for transportation. The cost of any type of transportation service may be an issue if the individual or family is responsible for all or part of the fare. All of the transportation in the world doesn't help if a person does not have the financial resources to afford it. Some individuals may find that the cost of transportation is beyond their budgets, or feel they could cope better if they could receive help in paying for transportation costs, for example, for the first few months on a new job until they get on their feet. Step 6 asks how much the individual is currently spending on transportation and whether they include that cost as a regular expense in their household budget. If not, they should be encouraged to do so. The amount they can put aside for transportation may not cover the full cost, but it will be a start. It will also more clearly identify transportation as an important monthly expense along with housing, food, and other costs. With the individual, record how much the individual is paying for transportation now each week, how much the individual can comfortably budget for transportation each week, how much additional funding the individual needs to afford necessary transportation. Step 6 also asks questions about sources of financial or in-kind support for paying for transportation. The following sources may provide vouchers, transit passes, or subsidies for taxi, carpool, or vanpool. Workforce development agencies, social service agencies, community action agencies, transit agencies, public housing agencies, faith-based organizations, educational institutions, hospital, and medical providers. Any sources that are applicable to the individual should be recorded on this worksheet. Also included in the resources for this module is a 2-page individualized transportation plan. Complete this plan in concert with the individual you are working with. Taking all the information uncovered in the transportation needs assessment, come up with at least 2 travel options for each type of trip the individual has to make. The next customer you will need to understand are any particular sections of the community that you and your network decide should be the focus of your efforts. These riders may be identified by their destination, their origin, services they receive in common, or other shared factors. For example, you may identify patients needing to make long-distance medical trips as your top priority. Or there may be a region in which the vast majority of workers need to travel to a neighboring urban center for jobs. For example, in Maryland, a van service was set up to bring lower-income workers from an inner-city area in one county into a neighboring county that had many unfilled jobs. Another grouping for individuals is by the agency that serves them. For example, you may hear from TANF, Temporary Assistance for Needy Families agencies, that more low-cost options are needed for their clients. Or perhaps a new manufacturing or medical facility is opening up, and the focus needs to be on moving large numbers of workers to that site. However you define the sector that you will concentrate on, conversations are again your best way to understand the needs. As we noted in Module 2, the ability to listen fully and empathetically is key to gaining a full picture of needs. Here's an important point. Because a mobility manager cannot meet with every individual who needs transportation, they should always take advantage of the existing network of staff in agencies and organizations who do see these individuals on a frequent basis. Through their connections with customers, patients, employees, etc., these staff, and in some cases volunteers, are more familiar with people's transportation needs and the impact a lack of transportation is having on their life. They are in a position to collect both data and anecdotal accounts of these needs and difficulties. The information they collect and, through the mobility manager, contribute to efforts to plan transportation options can help to make those options more responsive. Data on trips that people are unable to make can be some of the hardest data for transportation planners to find. The mobility manager can become the point person for collating that data and sharing it with the appropriate partners. As you can see in this graphic, the mobility manager becomes an information nexus, or the connector who has the knowledge of both sides of the equation, available and potential transportation services on one hand, and the transportation needs of individuals served by agencies and organizations on the other hand. You may learn about individuals' needs from agencies and organizations in 2 ways. First, through a referral process you may have set up with agencies for individuals who have unmet transportation needs. Or second, through a more formal system of collecting unmet needs. Agencies can set up a formalized process for collecting data on unmet needs that can be passed on through the mobility manager. The report of individuals' unmet transportation needs is a simple form that can be used to gather basic information on those individuals who have transportation difficulties. This form is available in the Resources section. The form asks for basic information on the individual's transportation difficulty. It also asks about what transportation options have been investigated for this person and why they did or didn't work. It is important for the staff or volunteer to inform the individual that he or she will be completing this form. If the individual does not wish to have any personal data forwarded, For transportation planning discussions, for example, they can ask whether the form can be completed without including the individual's personal information. Regardless, the individual should be assured that his or her personal information will not be shared outside of the agency without permission. On the back of the form is a place for writing a short narrative of the individual's transportation challenge. These stories can be very useful for sharing anecdotal information with potential funders of services and elected officials. Again, this type of detail-rich data is very difficult to gather and have ready when it is needed. Having this information collected in real time while other services are being delivered can be very helpful in putting a personal face on community transportation needs. Some communities have created an online survey tool for agencies to use in recording these unmet needs. One example is the Dallas Area Rapid Transit Survey for one of its service areas, Collin County. The link to this online survey is included in the resources. The third group of customers for a mobility manager is the public and private agencies and organizations within the community. In terms of serving employment and human service needs, the mobility manager can work with staff within these agencies, such as job developers, social workers, case managers, etc. In so doing, mobility managers can leverage the relationships these professionals already have established with individuals. Thus, the mobility manager's customers are also these staff in agencies. Mobility managers need to understand the reality of these professionals' daily lives and how to best serve them. For example, what is the most effective way for a mobility manager to inform them about transportation services that will help their clients? What type of process for collecting data on client unmet needs is the least burdensome for agency staff? How should mobility managers approach these agencies and their directors? A mobility manager's customer could be the organization or agency itself, which also has needs. For example, employment, social services, and other agencies often identify missed or late appointments as a frustrating and costly issue. When individuals have effective options to travel around their community, this can help reduce the number of late or missed appointments, lower resistance to following through with referrals, and enhance their clients' ability to adhere to training or treatment regimens and/or maintain employment. Another customer could be businesses. Employers are often concerned when their employees cannot get to work because their usual mode of transportation has fallen through, their car needs maintenance, they don't have enough money for gas, or their carpool didn't go that day. Or perhaps a youth services organization has lots of good after-school programs available, but youth can't get there. Or people going to a center for independent living are having difficulty getting to the site. All of these agencies and programs could effectively be your customers. One last type of customer are the members of your mobility management network. Although these agencies and organizations do not have transportation needs per se in their role as a network partner, they can still be the customer of the mobility manager. You, as the mobility manager, can be much more effective by understanding the priorities of your partner organizations, how transportation fits into their work, how it is currently provided, and the extent of their ability to focus on transportation. Also keep in mind that although all partners have a stake in community-level transportation, not all are transportation savvy or have transportation as their main focus. Their needs can include concerns about what changes in transportation mean for their agencies, businesses, or constituencies, a desire to see customer or client needs met, a desire to see that those working with their clients or customers adhere to set standards, time constraints for being part of the mobility management process, and the need to be educated about transportation issues. In this module, We have covered how to tease out the details and subtleties of transportation needs of many types of customers: individual riders and their caregivers, groups of individuals, agencies and transportation providers that serve groups of individuals, your mobility management network partners. Combine your skills as a mobility manager with an understanding of their needs, and you will have made good progress toward creating mobility solutions for your community. Please view the many resources and links to expand your learning beyond this module. Thank you for your participation.